Hi there. If you're seeing this video today, that's because we're talking about erectile dysfunction. I know erectile dysfunction is not the funnest thing in the world to talk about, but keep that in mind that you are not alone. Erectile dysfunction is very, very common. It affects millions and millions of men. There's multiple reasons why it happens. Diabetes, high blood pressure, low testosterone, Peyronie's, pelvic surgery, heart disease, stress, anxiety, depression. The list goes on and on. But the main purpose of this video is to talk about the treatment options regarding that. We can help you, and let me talk to you about how we can do so. So we always start with the pills, Cialis, Viagra, Levitra, Stendra, things that you've heard of. If you get a good response to those, then we can use things such as a vacuum device or a penile ring. If you don't have a really good response to that though, usually the vacuum device and the penile ring aren't gonna be great options. So what do we do next if that doesn't work? We have two options that are urology backed, FDA approved, and those are the penile implant, which is actually the best long-term solution to your erectile dysfunction if the pills don't work, and I'll explain to you why, or the penile injections. I'll start off with the penile injections. What we do with the injections is that we draw up a liquid medication into a vial and we inject that into the penis. I know it sounds horrifying, but it's actually very well tolerated. And the pro of the injections is that it is a potent medication and it can get guys rigid where they want to be. There are a few setbacks to the injections. Number one is that there is no spontaneity. When the mood strikes, you have to pause and then go inject yourself, and then it takes about 10 to 15 minutes. That can lessen the mood after that time period. The second thing is it doesn't always work as well. Sometimes it's more effective than others. And if it doesn't work as well, you get a performance anxiety up here. If you have a performance anxiety up here, it can affect how you perform down here. The other thing is you have to travel with them. You have to have them refrigerated. It's kind of hard to tote that around. And lastly too, you have to continuously poke yourself. It is an injection that is required each time you want to be sexually active. But I wanted to be thorough and let you know about that option. The second one is the penile implant. And again, like I said, this is the best long-term solution to erectile dysfunction if the pills don't work. There's many benefits to the implant. It's a 98% satisfaction rate, 98% success rate. It's covered by insurance, and these are by far some of my happiest patients. I first want to talk to you about how the device works. And here you're going to see a schematic of how that's done. So as you can see, we make an incision that's above the penis, well below the belt line. Then we insert the device. The device has three pieces. There's a reservoir that goes above the pubic bone, and then there is the cylinders that fill your natural blood chambers that give you the erection, but these cylinders fill those blood chambers, and then you have a pump that goes inside the scrotum. And then that device is completely internalized. I could look at you naked and I cannot tell that you have this device in. Nobody can. And it's connected through a tubing system that has fluid in it. When you want the erection, you simply just pump the device as shown here, and the fluid from that reservoir goes through the tubing system and fills those cylinders. Those cylinders then give you that rigid look and feel. It looks and feels like a natural rigid erection, and it feels like a natural rigid erection. It does not affect your climax. You can leave your device up as long as you want. You can even climax and still not have the device go down. It's like a superhuman power. And then when you're done, all you do is you simply push the device again, and the fluid then will leave those cylinders and go back into that reservoir. And it looks and feels like a natural flaccid penis. Also take note too is that you get very used to having that device in. If you're wearing a watch, a ring, glasses, you get so used to having those in, that's how the device becomes. It becomes a part of you. As I was saying, a very, very highly successful procedure. And why it's the best long-term solution to erectile dysfunction is multiple reasons. Number one, you get that erection on demand. That's great. When the mood strikes, you're ready to rock and roll. You don't have to wait on a medication. You don't have to wait on the injection to work. You're ready to go right then and there. The second thing is there's no performance anxiety up here because you know the device is going to work and the device does the work for you. When you have this natural, spontaneous erection and that's consistent, it gets you and your partner excited about sexual activity again. No other option allows for that. When people are in a relationship, The sexual activity goes downhill when you can't perform. So then it builds a gap in the physical intimacy of the relationship. Because, hey, honey, this is not gonna work tonight. Let's stop doing this. Let's stop talking about it. And then it becomes something of the distant past. But the penile implant is something that bridges that gap for us. Not only does it help with the relationship and the physical aspect, it also helps with the mental component of things. It gets you both excited about sexual activity again. When the sexual activity is there, it also helps with the rest of the intimacy of the relationship, but it also helps the patient themselves with their own confidence. Some men feel like they lose some of their manhood, they lose some of their confidence because they can't get erections, something that they've had their whole entire lives. This is something that brings that back to you. Not only that though, is that we have a finite amount of time on this planet to have sexual activity. So why waste our time doing things that don't work as well? There's only about a 15% chance that somebody continues on with those injections after a year. The medications are trying, they don't work. The vacuum device doesn't work. They've wasted time doing these things. This implant is something that gets you back in the saddle in a very quick manner. Some logistics regarding it, it's an outpatient procedure, one quick little incision, insert the device as we showed before. You go home the same day, you'll have some drains and a catheter and some dressings, but those things come out within 24 hours. There's about a 3-week recovery period, meaning that you're not bedbound by any means, but you are not able to have sex, do heavy lifting above 15 pounds, or do any vigorous exercise for about 3 weeks. But overwhelming majority of men, within a 3 to 4 week period, have the device in, they've completely healed up, and they can use this thing to their heart's content. And it lasts anywhere from 10 to 15 years. And overwhelming majority of time, it's covered by insurance as well. So this is why this is the best long-term solution to erectile dysfunction if the pills don't work.